Sinus infections, also known as sinusitis, occur when your nasal cavities become swollen and inflamed. This can happen for various reasons, but it often results in discomfort and can significantly affect your daily life. The sinuses are air-filled spaces located behind your forehead, cheeks, and eyes. Their primary function is to produce mucus, which helps keep your nasal passages moist. When these sinuses become blocked or filled with fluid, bacteria or viruses can grow and cause an infection. There are two types of sinus infections, acute and chronic. An acute sinus infection is a temporary condition that usually follows a cold or an allergic reaction. It typically lasts less than 4 weeks. Chronic sinus infections, on the other hand, persist for more than 12 weeks despite treatment. These may be less common, but are often more challenging to treat effectively. Sinus infections can affect anyone, regardless of age or health status. However, people with allergies, asthma, or structural blockages in the nose are at higher risk. Understanding what a sinus infection is can help you recognize symptoms early and seek appropriate treatment. Identifying the symptoms of a sinus infection is crucial for early intervention and treatment. The most common symptom is a stuffy or runny nose. This occurs because the sinuses are blocked, causing mucus to build up. You might also experience facial pain or pressure, especially around your eyes, nose, and forehead. This can be quite uncomfortable and is often described as a dull, throbbing pain. Other symptoms include a reduced sense of smell and taste, which can significantly impact your enjoyment of food and drink. You might also have a persistent cough, which worsens at night. This happens because mucus drips down the back of your throat, causing irritation. Fatigue is another common symptom, as your body uses energy to fight off the infection. In some cases, you might experience fever, which signals that your body is fighting an infection. It's essential to monitor these symptoms and consult with a healthcare provider if they persist or worsen. Early diagnosis can prevent complications and lead to more effective treatment. Several factors can lead to a sinus infection. Viral infections, such as the common cold, are the most prevalent cause. When you have a cold, the viruses can invade your sinuses, leading to inflammation and blockage. This creates an environment where bacteria can grow, causing a bacterial sinus infection. Allergies are another major cause. When you have an allergic reaction, your body's response can lead to sinus inflammation and blockage. Pollen, dust mites, and pet dander are common allergens that can trigger sinus infections in susceptible individuals. Structural issues, such as a deviated septum or nasal polyps, can also impede sinus drainage and lead to infections. Environmental factors such as air pollution and cigarette smoke can irritate the sinuses and contribute to infections. It's important to identify and address these causes to reduce the risk of developing sinusitis. Understanding the underlying reasons for sinus infections can help you take preventive measures. Treating sinus infections involves addressing the symptoms and underlying causes. Over-the-counter medications like decongestants and antihistamines can help relieve symptoms such as congestion and runny nose. Nasal sprays and saline rinses can also aid in clearing the nasal passages and reducing inflammation. In cases of bacterial sinus infections, antibiotics may be prescribed by a healthcare provider. However, antibiotics are ineffective against viral infections, which are more common. For chronic sinusitis, treatments may include corticosteroids or surgery to correct structural issues and improve drainage. Prevention is key to reducing the frequency and severity of sinus infections. Practicing good hygiene, such as washing your hands regularly and avoiding close contact with sick individuals, can help. Managing allergies with medications and minimizing exposure to allergens is also beneficial. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can boost your immune system, making you less susceptible to infections. In summary, understanding the causes and symptoms of sinus infections is essential for effective treatment and prevention. By taking proactive steps, you can reduce the impact of sinusitis on your life and maintain better overall health.